Welcome back. You're watching The Globe. We go back to our lead story now. Some undocumented migrants who live in South Africa have appealed not to be forgotten in the vaccine rollout programs in the country. The International Organization for Migration, the IOM, has also appealed to everyone to be catered for regardless of their status. Meanwhile, the Department of Health says plans to cater for undocumented migrants who might want the COVID-19 jab will soon be finalised. For more on this story, we're now joined by Africa Diaspora Forum spokesperson Amir Sheikh. Thank you very much indeed for joining us and welcome to the programme.
Thank you very much, Peter, and actually your listeners, much appreciated.
You must be welcoming this news that the Department of Health is trying to find a way to make sure that all migrants, undocumented or not, are going to get vaccinated.
Really, actually, the story is one that at least is appealing to us as members of the migrant and the diaspora community in South Africa, because we had the fear that, we may be left out and this will only prioritize the South African community. But for the first time, we are seeing that at least for those of us willing to go and take the jab, it wasn't actually a hurdle or a great process. But one unfortunate aspect is that a lot of education and awareness is needed because there is a lot of myth and misconception among the migrant community that will hinder them even not to go and take the jab if the government will not do a lot of awareness.
Well, tell us about some of those issues that might get in the way.
The fact of the matter is, Peter, when we had actually our fear was that we will be left out. But now, among the migrant community, there is a lot of concern that, this vaccine have got a sort of actually a chip inside it, and this chip will actually trace their movement in and out of the country, and they will no longer be actually free to trade, transact, or actually be themselves. So this is one myth that is surrounded within the communities, and messages are going around. There is also fear of actually potency, where they're saying that once you take this, actually you will no longer produce. So there are a lot of actually myth and misconception, and I think the government have not done much to address this, and it's not only among the migrant communities, also among the South African vast majority Black community, and also African in the continent. And I think that is one reason why the continent, despite even procuring a lot of actually jabs, is actually lagging behind in terms of actually the numbers who have so far vaccinated.
All right, so one of the reasons that people are undocumented is partly they've fled where they've come from for whatever reason, but there are other people who are here illegally. Is there not a fear that they may not come forward for fear of being caught, and that will then put their lives in danger?
Whereas we are welcoming, Peter, that at least, none of our members was turned away because of documentation, but then the concern and the fear actually you mentioned is one that is there. Many have got actually the asylum and refugee papers that have expired and that have not actually been reissued again due to the red tape within the Department of Home Affairs and the system not working properly. Others are undocumented, and for their fear, once they got there, they may actually get arrested. So that fear is there. But one fear that is actually stopping our members not to go forth and try their luck is the myth and misconception surrounding the vaccination itself.
All right. What has government been doing in terms of helping migrants, particularly undocumented migrants, access healthcare facilities to date? Because maybe that already points to some of the challenges they might have with the vaccination program.
Access to basic healthcare was always an issue within the migrant community. And despite the fact that those who have got proper documentation can access easily healthcare, it have always been a nightmare. We have seen many migrants actually turned away, many even actually, being sent a hefty bill after being treated. So healthcare was always an issue, and then the rejection among the migrant community was always high. With that in mind, and knowing that at least now the high infection rate in the country, many still fear that they may actually face a rejection if they go and present themselves with or without documentation.
Have you been working with the health authorities to try and formulate a vaccination program for undocumented migrants that's safe?
Within both levels in the country, yes, we have actually worked with the areas. We have also worked with organizations that have come forth in order to assist, like the Muslim Association of South Africa in Houghton, that have on Tuesday started also a process where even those who are the most vulnerable and cannot even come to take their vaccine, they can go actually register them in their houses, or they can stay inside their cars and actually get. So there is an effort of also setting up camps in areas that are predominantly migrant, places like Mayfair, or if it will be Yeovil, or a place like Babel or Costin, or actually in Polokwane, where we will actually willing to partner with the department so that we can remove the myth and misconception and urge our members. It is very important for them to come out and vaccinate themselves. I think if we go that process, a lot of numbers of the migrants will come out because of the trust that they developed with their leadership, and the process will be one that will be very smooth.
Are you confident that you can reach all of your undocumented migrants? Because you talked about an education program as being a key pillar to make sure this rollout is successful. But if they are undocumented, they may not be all that visible. Will you be able to reach them? Do you know where they are?
Really, we know where they are. And everywhere actually you go in South Africa, Peter, there are enclaves or a safe haven for migrants, whether they are documented or not documented. They are also actually aligned into countries. There is an area in Johannesburg, if you go, the vast majority in that area will be either people from Cameroon or from Zimbabwe or from Zambia. So we know where our members are, where they trade, and where they are safe, despite being undocumented. For us to reach them will not be a problem, but the problem is how are we going actually to remove this myth and misconception surrounding the vaccine before we even actually urge our members to go out and, register in large number and take the jab.
All right. And there's been, before COVID and during COVID, travel going backwards and forwards to home countries. Are some of these migrants planning to go home at all, to get vaccinated and come back, or what have you heard?
It's unfortunate in the countries that we came, some of them have not even started the process of vaccinating their own. It is only the leaders and those who are well off within the community and can afford that are only taking. So in South Africa, they have got a very good chances of going out and vaccinating. And for the first time, we are seeing that there is no actually priority in terms of actually race, color, or creed. So we urge our members, rather than going out of the country and going to seek one that we will not actually easily get, to remove the myth and misconception, come forward and go and get, and where they encounter problems, reach our offices in all 9 provinces in the country so that we can assist. We also welcome progressive provinces like the Western Cape that have now developed documentation and are willing to register and actually give the jab to any undocumented migrants who come their way.
Has the Department of Health given you any indication when a vaccine rollout program will begin including undocumented migrants?
Very unfortunate we are not getting that. We are not getting that, Peter, but what we hope is that we are reading the news. We are following actually the update given by the ministers. And what we will do is that we will make sure that at least we disseminate the same information to our members, and at least so that at least a good number of them can go out and take the jab.
How many undocumented migrants do you think are in existence that are going to require a vaccination?
Sincerely, the statistic is not clear, even from the department itself or from the statistician general offices, and the myth and misconception that have led to one of the attack against population of the migrant is overestimating the numbers. But to be sincere, or to be even on a rather estimate, closer to 150 to 200,000 may need to take the jab.
200,000?
Yes, 200,000.
Or you don't think there's more than 200,000 people in South Africa undocumented?
I do not want, unfortunately, I may not actually use, because if you talk of Somali community, for example, they always talk of a figure that is R500,000, but in reality, according to the government, those that are registered are not even more than 26,000 actually population. So I do not also want to take that route of saying there are more than 6 million Zimbabwean actually undocumented in Gauteng alone, and to be on the safer side, and also knowing that we have to debunk the myth and misconception, not even 100,000 will actually go out. But if they even go out, that will be a good number. And I do not overestimate, and I don't think more than that number are in the country of now.
Have these undocumented migrants been getting access to care once they've tested positive for COVID-19? What have they been doing?
The situation for the migrant is that documented or whether you are not documented, getting assistance was not actually forthcoming, despite actually whether you are a naturalized citizen, whether you are a permanent resident, a refugee or asylum seeker. And many of our members who have now actually tested positives did actually turn back to actually the vitamins, taking care of themselves, steaming up, and using some sort of traditional medicine to cure themselves, because there is also another fear or another myth within the migrant community that if you go to hospital and seek assistance with COVID, you will not come back alive. So there is this myth actually that is also stopping us not to also go to hospital and seek medical attention.
All right, so in a nutshell, good news that the health department is moving in the right direction, because there's a lot of work to do, and part of that is educating people to come forward and to get the jab.
Very, very correctly, and we welcome any positive gestures towards the migrant and inclusion in that. And we also hope that at least others will emulate the Department of actually Health, so that at least they will not discriminate us based on our countries of origin or our color or our creed. And this is a welcoming, and I hope the president also in his last speech said that migrants who have been actually attacked and who are not actually on insurance will be compensated. We also hope that actually the same gesture from the Department of Health will be the same gestures also, and in future we will not be discriminated based on our country of origin.
Mr. Amir Sheikh, we're going to leave it there. Thank you very, very much indeed for joining us on the program and sharing your insights with us. Thank you.
You are most welcome. Thank you.
All right, that was the Africa Diaspora Forum spokesperson, Amir Sheikh, talking to us about the program that the Department of Health is busy working towards vaccinating undocumented foreign migrants in South Africa.